Hey, Dr. Yen, inquiry minds want to know. My underwear doesn't smell very good. It actually smells kind of bad. Is there a certain type of smell that is supposed to happen?
So when this is taking me all the way back to high school, was studying the menstrual cycle, you actually could have discharge every single day of the cycle, and I was like, this is horrible and disgusting. But unfortunately, it just depends. Each woman's vagina is different. As I like to tell people, in your vagina you have yeast and you have bacteria, and they live together in harmony. But if you introduce something foreign, like a condom, penis, spermicide, or even just that time of month, it can mess things up. And for those people, it can push it towards yeast infection, which a lot of women know, white, cottage cheese, thick, itchy, that's a yeast infection. Or the one that's lesser known is bacterial vaginosis. And I actually did one of the seminal research studies on bacterial vaginosis. It's thin, gray, runny, and if you mix it with semen or something that's alkaline, which is the test we doctors do, we actually take some of it and we drop some alkaline solution on it and we smell it. You think we're crazy, but we're going for the whiff test. And that is bacterial vaginosis. And that means that the yeast have been killed and the bacteria have taken over, and it's this thin, gray thing that smells fishy after unprotected sex. So that's bacterial vaginosis. You don't have to treat bacterial vaginosis. It is a risk factor for preterm delivery. So if you're pregnant and you have this discharge and you have a personal history of having a preterm baby, then you got to get it treated. But if it doesn't bother you, no big deal. But if it bothers you, go see your doctor, provider. They will take a sample of it. They will look for sexually transmitted infections. They'll look for bacterial vaginosis. They'll look for yeast and other things. And then they can tell you whether it's something bad or whether it's something okay. And then if you've never had your period, because I've found a whole bunch of 12-year-olds bothering me a lot of time for these questions, is right before you get your period, 6 months before, you get a whole bunch of white discharge. It's actually called leukorrhea. Leuko being white and white blood cells. And rhea, well, actually, except just white. Rhea being runny, like diarrhea or runny nose or kind of rhea. So leukorrhea is perfectly normal 6 months before you get your period. So if you tell the doctor, hey, I've been having this white discharge and I've never had my period and I've gotten breasts about 2 years ago, your period's coming in 6 months. So those are the top kind of concerns I would think. And then to answer a question I know that's coming up, is, again, if you mess up that harmony between the bacteria and the yeast, you will get discharge. And how do you mess that up? You douche. You put in some feminine, harsh wipes, or you just put in a foreign body. So just know that really internally, never anything, just nothing other than what needs to go up and down there. And then externally, if you use too much soap, then it gets dry and you get infections and you get eczema, all sorts of crazy things. So no douching, no nasty high yield feminine wipes or anything crazy, and no vaginal steaming. I saw that the other day. Thank you all for listening on TMI Tuesdays. Hope you like the content we're providing. If you do, absolutely follow us on Instagram, Twitter, Facebook. We have amazing frequently asked questions about anything in the birth control realm. And I love our blogs, and we also have YouTube. So you can find us many places. Share with friends. PandiaHealth.com.